Hello, good evening, viewers, and welcome to your favorite medical show, Ask Dr. Saw. We're back and we have your questions from last week, quite a few, well, not many questions from last week, but myself and Dr. Saw are going to be going through those questions. Today we have a very tight show, 30 minutes, but we're going to try, because we just have a few minutes from, few questions from last week, we're going to fit those questions in today also. So today we are talking about gallstones, and as you know, last week we spoke about diarrheal disease. So still in England, Dr. Saw, welcome.
Oh, thank you, Akash, and to the viewers. Good evening.
Right. So viewers, as you know, this show comes to you every Tuesday night from on this platform, on the Guidance Critic platform, and on my page also. And remember to send in your questions while the show is going on, so that next week we can answer your questions. That's what this show is about. It's about bringing this information to you, but also to answer your questions on in any or that you may have in terms of concerns or queries or so in the medical field and medicine. Dr. Saw is here and he is quite capable of answering many of the questions. If he can't, he says he can. So again, good evening, Dr. Saw. We are talking about gallstones this evening, and this is something that I've been hearing about since I am small, but yet I don't quite know exactly what gallstone is. So I'll be glad this evening if you can start off by telling us what are gallstones and how do you get it?
Yeah, no, indeed, of course. So we know what a stone looks like, right? So it's a hard substance that comprises of different material. But in particular, gallstones. So first of all, we want to know where is the gallbladder and what is the gallbladder, and then you would have stones formation in the gallbladder. So let us just put that picture up of where the gallbladder is. So the gallbladder is just by the liver, and
yeah. So the picture is there, Doc. Yes, you can see it, but the picture is there. Yes.
Yeah, of course, that's fine. So the gallbladder by the liver there, it has usually, if you eat chicken, you will know when you kill a chicken, you'll see the liver and you'll see that bile.
Yeah, the little green. Yes.
Right. So that's the gallbladder, and we have a similar organ in the human body as shown on that diagram. So it contains bile acid, and bile acid is used for digestion of fats. So that bile, when you eat food, the gallbladder contracts, and you have excretion of the bile into the intestine, and it helps to digest your food. So that's the purpose of the gallbladder. Now, invariably, you have stones formation in the gallbladder. And the theory, so what a stone comprise of? The stones would have cholesterol product. So the theory says that it is usually caused by an organic focus. So let's say an infection. So you have an infective focus, and then you have a buildup of stone over time. And the common component of the stone is cholesterol.
Oh, really?
So you would, yes. You have cholesterol stone, and then you have pigmented stone. They're made up of bilirubin, we call it. And then you can have calcium stones, and then you have mixed stones. So there are various components in the stone that form stones. And actually, when you see the stones, they are hard like stones. But it is not brick as in cement in the stone, but of course it will have calcification and you'll have those cholesterol component in the stone. So that is actually gallstone in summary.
Yeah, go ahead.
Yeah, go ahead.
All right. What I want to ask, Doc, is that very often I hear about, when people got gallstone, I hear about this excruciating pains and so on that accompany this. What are some of the risk factors involved in having gallstones, though?
Sure. Yeah. No. In university we were taught that the classic patient presentation with gallstone is a fat, fertile, fair female over 40. So if you have that features, they will say that's your typical classic patient. However, of course, we see men, women, everybody has got gallstones.
So is it,
and it doesn't...
Is it prevalent? Is it more prevalent in females then?
That's correct, yes.
Right.
It's more prevalent in female. So but the description, yes, if you're obese, is a higher prevalence as well. Female is a high prevalence, but there are certain risk factors that we would say. So, female sex, pregnancy, people who use estrogen pills, certain demographics in terms of ethnicity. In the Asian subcontinent, it is less. What else? You have patients who have lost rapid weight. So rapid weight loss can be a risk factor. If you've had gastric surgery, gastrectomy, you can have like patients who have cancer of the stomach, or even patients who have had bariatric surgery for weight loss. They have a higher risk as well. If your diet is more carbohydrate based and processed food, those are all risk factors. What else we've got? And there are certain predisposition. Patients who have got, there's something called hemolytic anemia. So where your blood cells are broken down. So let's say sickling patients and certain other autoimmune condition where your blood cell is destroyed and it's broken down, it can give rise to what we call pigmented stones. So those are your classic, those are your type of risk factors that make you more prone. And sedentary patients who live a sedentary lifestyle, if you don't exercise, you have a higher risk. So I would say, those are your risk factors. But anyone can get gallstone. I don't think, classically that, yes, it fits that description in all cases, but it's quite common. It is estimated about 15% of the population would have gallstones. That's a big percentage. Fortunately, majority of them, they are asymptomatic. That is, they don't know. So not everyone who has got gallstone will have symptoms of gallstone.
Well, that was the next thing I want to ask you about. I want to ask you, how do you know you have gallstones? And you just said many patients are asymptomatic, they don't have symptoms. Now, I want to ask also as a follow-up to that, being asymptomatic, is it a good thing or a bad thing? Is it because I'm thinking that you're supposed to know you got something, because if you don't know you got it, they say it might be too late. But what are some of the symptoms though?
Well, it is not one of the things that you would say that if you don't find out about it, that they will do harm. Okay. Necessarily. It can do, but not in all cases. As I say, majority of patients are asymptomatic. So we find that incidental findings, so let's say you have a scan for something else, you may have gallstone, they may find gallstone. And it doesn't mean you have to do something. But of course, if you have symptoms of gallstone, so let us clarify that point. If you have gallstone, it doesn't mean it is harmful or it will go bad with you. And it doesn't mean you have to treat it. And it doesn't mean you will have symptoms. Okay. So lots of patients would have gallstones and they don't know they have it. So we call that asymptomatic gallstones. Right. And the current guidelines tell us that there's no need to treat asymptomatic gallstones. So if you have gallstones and you don't have symptoms, possibly don't treat. But let us talk about how do you know you get it. So we have symptoms of a condition. So any condition you will have symptoms of it. And there are some patients who don't have symptoms, so we call it asymptomatic. So how do you know you get it? You can have an ultrasound for something else. Let's say you have an ultrasound for your liver for another reason and they find gallstone, so you know that it's there, but we'll come back to that. But the classic symptoms, so then you have what we call symptomatic gallstones, and that's the one we are concerned about. So you have gallstones and it's causing symptoms. And what are the symptoms? So gallstone you can have gallstone there and you have colic. That is, you have spasm, you have contraction of the gallbladder. So every time you eat food, especially oily food, the gallbladder contracts and it squeezes bile out. And that aids in the digestion of your food. So if you have gallstones, remember that function is impaired and you would have movement of the stone. It causes contractions of the contraction of the gallbladder, and you have colic, biliary colic of the biliary system. You would have spasm. Now that can give rise to pain. So classically, the patient would have upper quadrant. So where the gallbladder is located, as you see, it's just by the liver, under the liver, and the liver is on the right side under the rib. So that's
Right.
where your gallbladder is, and that's where you'll get a pain. So these patients will have biliary colic. So this is a biliary colic type of patient. So they have pains, they may feel sick, nausea, vomiting. So nausea, vomiting, pain, and especially worsen on eating oily food. So anyone who comes in and say, "Doc, every time I eat food, especially oily food, I've got pain under my right side of my rib, and I feel sick, and of course after a while the pain goes away, but the pain comes and goes," you should always screen them or say, "Fine, that may be biliary colic." You may have other like bloating, indigestion type of feeling as well to go with that. So you may acid reflux, like heartburn, reflux symptoms. So those are, you would want to check for that. Then you have cholecystitis. So the gallbladder can get inflamed. Now this is a little bit different. This is inflammation of the gallbladder, or infection of the gallbladder, and or infection. So you have inflammation and infection of the gallbladder. In that case, this is a little bit more serious. You will have temperature, you will have fever, severe pain. So if you have fever, pain in the right, and when we touch it, we press on the gallbladder, you'll have pains. So that's a sign you're looking for. That can be serious. Now, if you have an infection, the infection can spread into the biliary system, that is in the whole tract of the gallbladder, on the liver, and you can be septic. And as you know, sepsis is a big thing. Sepsis leads can be fatal, so you'd want to tackle that. So if you have high temperature, you get chills and rigors, your blood pressure is dropping, your pulse rate is going up, of course that can be biliary sepsis. There are patients who can have complications due to gallbladder problem. So the gallstone can move, and you have the bile duct. So it moves into a tract, and the pancreas is also attached to that tubing, that tract, right? Now the pancreas expel digestive juices to digest your food. Now this gallstone can get blocked by the pancreas, and it blocks the flow of pancreatic enzymes.
Okay.
So those digestive juices that are coming out of the pancreas, if it blocks the duct, you can't have the flow of the digestive juices, and those juices can destroy the pancreas.
Wow.
Or you have inflammation of the pancreas, and you have something called pancreatitis. Now, that's very, very serious. If you have pancreatitis, it can be dangerous, and it can be fatal. It can lead to shock. So you lose so much fluid, it digests the pancreas, your blood pressure drop, you go into shock and sepsis. So it is not an easy condition that we should trivialize. We should understand what is gallbladder, what is gallstone when you have it, but not to say that everyone who's got gallstone should start to panic and say, "Hey, I have to get it fixed, or I have to have my gallbladder removed." You have to choose selected patients. You can monitor the gallstones. So small stones, you could say, fine, it's not causing any trouble. Usually they say if the stone reaches about 8 millimeter, then you probably start having symptoms. But there are times when the stone go and it cause blockage of the bile duct, and it obstruct the flow of bile. Now bile has got this yellow color, right?
Yes, yes.
So if the bile is blocked and it's not flowing into the intestine, your poo, that is your stool, gets clay colored or whitish.
Okay.
So if the stone block the bile duct, so these are the danger signs to look for.
Right.
It blocked the duct, your eyes get yellow, so that's jaundice.
Yes.
So you get jaundice, the bile duct is blocked, so the bile doesn't flow, your urine becomes dark. So instead of your urine become yellow, it is dark, like tea colored or Coca-Cola colored. And then you can have white stool or clay colored stool. So anyone with gallstone who have got yellow eyes, jaundice, who have got clay colored stool and dark urine, that's a medical emergency.
Wow.
So it is not so it's not so trivial. And also gallstone, if the gallbladder gets inflamed and it gets recurrent infection, what tends to happen, the gallbladder can get stuck to the bowel and it forms an opening. We call that a fistula. So if the gallbladder gets stuck to the bowel, instead of the bile flowing through into the duct, which are small, it flows direct into there, and the stone moves into the intestine, and it can cause obstruction of the intestine.
Wow.
We call gallstone ileus. So there are lots of complications. I don't want to,
I know, yeah.
I mean, it's for more academic purposes, and we don't need to discuss all the complications. Just for patients to understand, the gallstone is usually, is a simple condition, but if it gets complicated, it can be dangerous.
I mean, so you talk about a lot of symptoms there, but if these symptoms don't, I suggest, I think that these symptoms will present themselves once something is happening. But are there any other tests that you will want to carry out though to ensure that?
Right. Yes, of course. So the hallmark, I mean, the standard test we do for gallbladder or gallstone would be an ultrasound scan.
Okay.
It's simple, it's non-invasive.
Right.
It's just a scan. So anyone who's got pains in the gallbladder, we'll just scan them, say, fine, you've got gallstone. If there's a blockage, we'll see that there's a blockage. And there are also other invasive testing. You could put a camera down and have a look into the biliary tree. So you could see stones in the tree. That is when you do an endoscopy as well. We can do MRI scans of the gallbladder tree as well. So you can do that. Other tests, there are special tests to check the function of the gallbladder. There's something called HIDA scan. So where you could see, so the gallbladder meant to contract well, excrete the bile. You can check the contraction state of the gallbladder. You put a radioactive dye tracer, and then you do a scan, and you see how it excretes the bile, how it contracts. So these are all more sophisticated and complex testing. But for standard tests, it would be your ultrasound scan. Now, of course, if a patient is ill and unwell, you may also want to do other tests like check their full blood count. You want to check their inflammatory markers. You want to know if they're having an infection, if there's raised white blood cell. You want to check their kidney function to make sure that they're not dehydrated and they're not going into shock. So those are your standard, bloods and ultrasound scan.
Brilliant. I know at least two persons who've had surgery for gallstones. Is surgery the only option, or are there other treatment for gallstone?
So, by majority of cases, surgery would be the recommended thing if you are symptomatic.
Okay.
So if we were to just go through treatment, there are other treatments in terms of non-surgical treatment, but the current guidelines would not recommend non-medical treatment unless it's for patients who can't tolerate the surgery. Then of course we can consider medical treatment. The problem with medical treatment, so there is a drug that we can give, ursodeoxycholic acid. Ursodeoxycholic acid is called. Ursodeoxycholic acid.
Okay.
Long word. So you can give that, and it can cause dissolution. It can dissolve the stone. But we found that one, it is not very, very effective. It can probably work in only about half the patients. Two, you can have side effects of it where you have diarrhea and your liver enzymes go up. And three, you have a recurrence of the stone lots of time, and the treatment got to be long term. So it is not a current recommended treatment necessarily. It is more for patients who can't tolerate the surgery or are unfit for surgery. Surgery is your hallmark of treatment. So there are different types of surgery you can do, but the standard surgery, as in you've got a gallstone, you just have something called a cholecystectomy, where they remove the gallbladder.
Okay.
And nowadays, in the old days, we used to go open surgery. So you cut the abdomen, You find the gallbladder, you take it out, and you know, resect it. Whereas now, most of the surgeries are done laparoscopically. So you
Right.
go with a keyhole surgery.
Yes, yes.
So you have less, most laparoscopic surgery, you have less, faster recovery time,
yeah.
less trauma to the organs and the
Some people are out of
you know,
hospital within 24 hours.
Absolutely, yeah. So that's your kind of standard medical treatment. I mean, patients who have asymptomatic gallstone, as I say, the current guidelines would not recommend for us to go and operate in them. However, I will tell patients, I mean, lots of patients, if you were to ask patients, do you have acid reflux, do you have pain, and if they know they have gallstone, almost always they will say, well, you know, I have different pain when I eat, I may have a little bit of pain here and there. So if I'm investigating a patient coming in with abdominal pain and reflux symptoms, and I'm investigating them for gallstones, and they're found to be positive, then I would say they need treatment. But if I did not go looking for gallstones, and it was found as an incidental thing when we're looking for something else, then I may suggest to them that there is no need for for treatment. We can wait and observe. But you have to know, I mean, what you would want to do is educate patients onto what are the red flags, what to look out for. So you're looking out for infection, and you're looking out for blockage, obstruction. Those are the two important things. And we spoke about that. The blockage, if it blocks the bile duct, it will cause jaundice, clay-colored stool, and dark urine. If it is infected, you'll get fever, severe pain under your rib, and of course, you can get jaundice as well, but you'll be very ill. If you get those things, see the doctor immediately.
All right. So, Doc, before I thank you so much for this evening. But I one more last thing I want to ask you before I go to the questions. And remember, viewers, please send in your questions. Myself and Dr. SAWH, we're going to go through your questions next week. Continue to send in your questions. We just have a few questions from last week, Doc, so we can wrap it up quickly. But last thing I want to ask you before I go to the questions: complications with gallstones. I mean, let's say somebody you don't know, you're asymptomatic, you go to work, and all of a sudden on the onset you start having some symptoms, and you start having what do you recommend in the interim before that person can reach a hospital? Should they take like a what can they do?
Well, painkillers would be the general thing. So if you have so if you have symptoms, so the most common symptoms would be biliary colic.
Right.
So that's a colicky abdominal pain.
Yes.
So your painkillers. So you want to drink enough fluids. You want to avoid fatty meals because those are the provoking factors, and you want to take painkillers. So your standard, whatever painkiller works for you, you just take the painkiller. You drink well hydrated, and you avoid big meals or fatty meals. And now that's your standard before you reach the hospital, when they will do all these other tests. If you're infective, then they will recommend antibiotics. And then, of course, you may need infusion if you're dehydrated. You may need other treatment, and then subsequently removal of your gallbladder.
All right, great. Brilliant. Thank you so much. Doc, we're going to move to the questions immediately. Now, I wanted this question. I think I sent it to you because we think we're going to have to cover this one on a topic by itself. It said, Doc, can you talk a little bit about dengue fever? One 11-year-old died last week.
Yes, I mean, dengue is prevalent, as you know, in Guyana. It's prevalent, tropical countries generally. It's a virus. And unfortunately for viruses, we don't have treatment for viruses most of the times, right? Some antiviral we have for other conditions, but for dengue, there is no specific antiviral to treat dengue. So dengue treatment is actually supportive. Thankfully, majority of patients with dengue, they are asymptomatic. That means they don't have symptoms, and the ones that have symptoms do have mild symptoms. And what is mild symptoms? Would be mild flu-like symptoms.
Right.
So a lot of times, you know, I see this in the newscasts all the time. Patients visit doctor and they are diagnosed with viral infection, and then it turns out to be dengue. Well, yes, that is possible, and we have to understand that lots of viral illnesses, they overlap. They present with all the same thing. You have aches and pains in your body, and you have fever. Not every aches and pain in the body with fever, we will start panicking and say, hey, this is dengue and we need to admit you in hospital. But dengue has got a course that can be fatal, that it can cause complications and it can be serious. And yes, you have to, if I see a patient with symptoms of any viral infection, I would normally tell parents what to look out for. What are the danger signs? So if you see any of those danger signs, you present to the doctor back. But I wouldn't be admitting every patient with aches and pains and a flu-like symptom to the ward. But of course, let us look at when do I worry that, okay, dengue, this is a little bit more serious. So we want patients to be aware of the condition, and if it's prevalent in the community, you would say, fine, this is a high risk in the sense that we know dengue is prevalent here now. There are people around us have got it. My child has presented with symptoms, or I have presented with fever. But they said the features, you will have aches and pains in your body, and you have pains in the eye, retroorbital in the eyeball, you're having pains, headache, and of course, you can have bleeding. So when it becomes complicated, then you have all the other things. But in the initial stages, dengue can be mixed up with any virus.
Okay.
So you just have to look out for a thing. And there are certain, if I do a blood test, and normally patients come in and they see the doctor and you're not sure, you think this patient is more ill, of course, run some tests. And you would see that the white blood cell may be a little bit low. There's something called a hematocrit tend to be high. Platelets tend to be low. So there are certain markers of the blood will tell you, hey, this looks like dengue. And then there are special tests you can do. You can do what we call immunologic tests for dengue. And then you can even check for the virus itself in the body fluids and the blood. So there are lots of things, but unfortunately, I didn't follow up this case you're talking about. I don't know the details, and it's difficult to pronounce on individual cases. But the story is, it's unfortunate when these things happen. But I always say to patients, be vigilant, know what to look out for. And for colleagues, my colleagues, I always encourage when I teach sometimes, I would say, if you see anyone with a symptom, any illness, it can evolve into something later on. So don't say, fine, this is nothing, and trivialize it.
Right.
You can have a simple flu and it can be dangerous. So, yeah.
All right. So Doc, we got about 3 minutes more, Doc. I got 3 quick questions for you. Doc, does drinking probiotic pill daily helps to prevent diarrhea from bacterial infection?
I would say I would recommend that yes, it may have a role, not necessarily in all cases, but probiotic is well recognized to help the gut bacteria. So if I say that your intestine has got lots of bacteria, and if I augment those good bacteria in the intestine, it may help to ward off bad bacteria. And of course, it helps your digestive system in so many ways. It helps your autoimmune, it helps your immune system, because your immune system is about fight infection. Mm-hmm. So I would recommend probiotic. So yes, of course.
Oh, great. Next question, Doc, can acute diarrhea cause miscarriage in pregnant women?
Difficult one in the sense that I don't have enough literature evidence to say that's the case. But we know that, so I wouldn't say the diarrhea per se will cause, but if somebody has got severe colicky abdominal pain, lots of colic, and
pressure in the abdomen,
potentially, but I would say that the answer to that, the answer is no, really, for most part, because people worried, if you have a pregnancy that is implanted properly, there's nothing could knock it out. So people sometimes worry, a bit of diarrhea as in colics, you will get that, no. But if you have severe, I would imagine theoretically it is possible, but I don't have any medical evidence to substantiate that, or I haven't looked at the literature in detail to say, right, diarrhea can give rise to pregnancy. Mostly, you can have a coincidence where you have a bit of diarrhea, you have a miscarriage, and you link it. But generally, I don't think the trauma is so much that the spasm of the bowel is so much to disrupt a pregnancy.
Okay. Last question. what about H. pylori, doctor, with the chest inflammation? What caused that? So I believe that I think this person is asking about inflammation of the stomach and H. pylori at the same time. Does one cause the other?
Yeah. So we get confused sometimes with H. pylori in the sense that, so it's not a chest infection necessarily. H. pylori lives in the stomach, right? So the stomach there. Now, patients get H. pylori, they don't know. H. pylori usually it lives in harmony with us, generally. So if you look in endemic areas with H. pylori, in developing countries, you have high prevalence of H. pylori and people don't really know. And when it starts causing that balance is disrupted, it can cause indigestion symptoms. And of course, there are risk factors of ulcers and peptic ulcer disease and things like that. So if you have H. pylori, I would imagine that most people who are going to be tested for it, we don't take the population and say, hey, let me check you for H. pylori. You'd have to come to me and say, doc, I'm getting reflux symptoms, I'm getting some GI symptoms, and then I'll test you for H. pylori. So when we do the test, there are different tests you can do. So you have so the blood test is not very accurate to tell you if you have current infection. So it doesn't differentiate if it's an acute or a past infection. So I don't usually recommend that patients have a blood test to check if they have a present infection. A breath test can tell you that. So you blow into something and they check that. Or you do a stool test, a poo test, where they check for H. pylori antigen. If that is positive, of course, you get eradication treatment because you are symptomatic. And also when they do the camera test, they normally can take a sample and test it. Okay. So the question was if it causes chest infection or inflammation.
Yeah, that's right.
Well, it causes inflammation of the stomach, so it can cause gastritis, ulcers in the stomach, and if you associate a little bit of that around the chest area, but it doesn't cause lung infection.
Okay, good.
It's more stomach related.
All right, Doc. Thank you so much. Viewers, thank you so much for joining us tonight. It was an amazing topic that we covered tonight, talking about gallstones. As I said, share this information with others, share it to your friends and your family, because this is important. We're here discussing health matters, and these health matters, so that if you have symptoms or you believe that you're suffering from any of these conditions, you can seek medical attention early. So thank you so much for joining us. Dr. Sawh, anything you want to say in closing this evening?
No, I think, we have done a good deal on the topic, and I think it's, we just sharing the knowledge there for patients to have an understanding of what's going on. And of course, this does not replace proper medical attention if you were to be symptomatic. The intention is just to give you a summary of things and for you to have a better understanding and when to panic, because I see patients, for instance, coming back to gallstone where lots of people, they've got asymptomatic gallstone and they're worried, do I have to take my gallbladder out? And sometimes, yes, they end up having the gallbladder out for not necessarily justifiable reasons. So just bear in mind that not all gallstone you have to operate on.
All right. Thank you, Dr. Sawh. So viewers, thank you so much again for joining us. We'll be here again next week to answer your questions from this week and bring another topic to you. Remember to stay healthy, stay safe, and the roads are wet, drive safe. Good evening, everyone.
Good evening. Thank you.